The following program was produced by an independent community producer. The opinions expressed do not necessarily reflect those of the ECAT staff or board of directors.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
Hi, everybody, and welcome to another edition of Humanity First. My name is Peter Evers, and I have the pleasure of working for BAMSI. And we have some big news, probably the biggest news in BAMSI's history for quite a few years. Last week, we announced the merger between two companies, ourselves and a company called Bridgewell, which is up on the North Shore. And today, we have the pleasure of having the CEO of Bridgewell, Chris Tuttle, come to talk about that. And we're going to have a conversation about why this is happening and why this is going to be beneficial to the people of Brockton. In fact, the principle of this merger between two equal companies is really to provide a better level of service for the people of our communities. And that community with this merger, which is going to happen on July 1st, is really going to go from New Hampshire all the way down to Rhode Island, the borders of both those places. And so it will be a service delivery system that is really going to improve the lives of many people as we go forward, especially in a time like this when things are so difficult with some of the issues that are happening in the federal government. So Chris Tuttle is coming up, so stick around.
Hi, I'm Jamie. I'm an essential worker here at BAMSI, and I'm a nurse. Nurses are essential here at BAMSI because as nurses, we really have the opportunity to make an impact. We have very small ratios, so we have the opportunity to really learn everything about the person served and be able to give the best care. It really serves such a great purpose for me as being a nurse and really why I came into nursing. Learn more about nursing opportunities at bamsijobs.org.
Giving a voice to the voiceless, pulling stories out of the shadows and putting them under the spotlight, making sure that each person is valued and cared for. This is Humanity First with Peter Evers, presented by BAMSI.
And welcome back, everybody, to Humanity First. I am your host, Peter Evers, and since you've been away, we have our special guest arriving with us, Chris Tuttle. Hi, Chris. How are you doing?
I'm doing well, Peter. How are you today?
I'm good. Now, in the interest of full disclosure, I think I have to tell everybody that Chris and I have known each other for probably far too long as far as you're concerned, right, Chris?
We've known each other so long that I had a full head of hair and my beard was brown. So yes, we had known each other for a very long time.
So that's quite a long time ago. And Chris is the CEO of an organization called Bridgewell, which is up in Peabody and covers the North Shore and is pretty much like BAMSI in that its mission is really to improve the lives of people in their local communities. And in some ways, Chris, just to kick off this whole question, because I promised the listeners at the top of the show that we were going to talk about why. Why do organizations like us get together and decide it's a good idea to merge to provide these services? So let's talk a little bit about the rationale, but let's start by saying, how on earth did this come about? So do you want to take a stab at that one?
I will, and I think it's a really good question, and I think a lot of people are asking themselves that same question about just how do two large organizations come together. And I think for you and I'll speak just for me, it's been a couple of years in the making. I think as we've been hearing from the Commonwealth and from the Executive Office of Health and Human Service, that their view over the last couple of years is that they really were looking for some consolidation on the provider side. That, we had heard from secretaries in the past that there were too many of us, that they were really they really didn't want to do business with 300 nonprofits. And they really felt, and I tend to agree, that as you consolidate more and bring more providers together, you have a better continuity of care. You have a scale and size that actually is able to offer families and individuals more services under kind of one umbrella, one roof. And so that has been my thought process as EOHHS has been talking about this, that we really needed to find a partner. We really needed to find somebody that was similar to Bridgewell, that was mission driven like Bridgewell, but not necessarily in our backyard, because that really doesn't accomplish what I think the spirit of what the Commonwealth and EOHHS was looking for, which was this broader community and broader service area. So I think that is really kind of what led to our initial conversations almost a year ago. I mean, we're talking, I think we first started the introductory conversation sometime in late April, early May. And in full disclosure, I think over the time that you and I have known each other, we've talked about this in a broader sense of how do we provide better care and better services to our families, and really kind of mimic that one door, and how do we accomplish that? So in a long-winded way, that's kind of how this all kind of came to be.
No, I think that's a really interesting fact, because if you talk about mergers, most people think about for-profits, right? And they think about, stakeholders, shareholders, and how you make shareholders happy in for-profit businesses by paying dividends. Nothing like that with a merger in not-for-profits, right? This begins, any good merger in non-profit begins with this notion of how do we provide better services for the people we serve. And yeah, go ahead.
I was going to say, absolutely. And I think the approach that we took, and I think others will take, is that our foundation of this merger was based in that, is how can we improve on the top-notch quality care that both agencies provide already, but by coming together, we can provide and expand our services for a better outcome.
Yeah. We did some work with on the DMH side recently about our system of care. And what they found from this was organizations that refer within their own system of care are much better at following the bouncing ball of care for those people. So that you mentioned before this sort of one door that people come through. And they found that when those referrals are actually shared between different organizations, really do fall through the cracks, and people don't get those services that they need. And it really struck a chord with me because it was before last week. It's before we went public with this. But that really is the fulcrum of this, isn't it? How do you get a system? And by the way, we're an organization that has the same electronic medical record. So all of the people, the 50,000 or so people that we're going to be seeing, are going to be connected through the system of care to every service that's available, which is really the benefit.
Absolutely. And I think what you and I both know, and we've talked about in the past, is who's ever referred to us, whoever we have the privilege of serving, ultimately, it's generally just not them. As you get to know them, as you get to know their story, there's an extended family, there's an extended network within that family system that might benefit from additional services that they're not in. By being one agency with this expansion, we're able to offer that extended family more service. And generally, because of where we're now going to be located in the north and south, not all family lives in the north. We might service an individual north, but they have extended family down in the South Shore.
Right.
The ability to say, you only need to tell your story once, and I'm going to put you in contact with this person. And this person within our system is going to be able to look at your record, look at everything, and be able to offer those services to you right away.
Right.
And I think that's what's exciting for me about this, because to your point around our system at times is very fractured because there are multiple players within the system of care. It's very easy for things to get lost and for things to be dropped. And under one roof, through one door, you're able to kind of knock out the noise.
Yeah.
And get right to the heart and get people the help they need as quickly as possible.
Yeah, and I think that's what the state are asking us to do as well, right? When at the top of the show, we talked about our funders wanting this, and it means to them, I think there's going to be some more efficiencies in terms of making sure that there is one story being told, and that maybe right now would be a good time to talk about an example of that. And within our service delivery systems, we're similar, right? But we do different things. So from BAMSI's point of view, I'll give you an example. We provide early intervention and women and infant and children benefits to people who have just had children. Now, a lot of those people might also be suffering or struggling with some other issue like postpartum depression, poverty issues, and that notion of being able to refer somebody wherever they are, wherever they live, to another service. So give me an example of a service that you guys would have that might be able to help with somebody who is struggling with insecure housing or something like that.
Well, I would say is that was the example I was going to use. Is we are a housing authority up here in the Northeast. So Bridgewell alone has 145 housing units, from single room occupancy to 1, 2, and 3 bedroom apartments. So we work with a great deal of families that are dealing with housing insecurity. You're also talking about, you're working with families and individuals, and let's just take young mothers, who might also have a recovery history or an addiction issue. Bridgewell provides recovery and addiction services that then also, and we specialize in working with young women, young mothers, in that transition and in that journey within recovery. So there's a lot of complementary services. And the other one I can think of is, though we're very similar in the work that we do with adults with intellectual developmental disability and autism, but one of the things that separates us out that I think also is beneficial is Bridgewell runs a specific clinic, an outpatient clinic. We're only one of 2 in the state that specializes working with adults with IDD or autism who also have a diagnosis of a mental health diagnosis. Yeah. So I think these are a lot of complementary things. And to your point, the early intervention and even the senior care that you do, I think is going to be very important to the complementary to the people that we serve. And even women and infant and children services that you do. So different, yes, but there's a great deal of synergies among the different services that we provide.
Yeah, and I think, when you go back to these things, somebody once said to me, there's a million reasons why a merger doesn't work, and there's probably 4 or 5 why they do. And I think we have sort of settled on some of those 4 or 5. When you look at, 2 agencies that are similar, what's really important about this is that this is a merger of equals, right? It isn't as though one agency is sort of rescuing the other. This is happening in the best of times, in that there are 2 organizations that are financially stable, that have something in the order of $240 million worth of business that we're doing with about 50,000 people. And so that it isn't like there's going to be an anchor of financial stress or anything around this. I do think that's really important. And I think the other thing is that we have 2 boards who think very similarly and oversee a culture of compassion and a culture of inclusion and a culture of just doing the right thing in a nonprofit. And that was the thing that really attracted me to this, apart from your dazzling wit and lightning repartee, naturally.
I'm glad you brought it up, because I think your point about a merger of equals is incredibly important, because generally when you see mergers of this size, you're absolutely right. It is about rescuing somebody or someone, and there are underlying factors to it. But because this is a merger of equals, it allows us to be creative right out of the gate. There isn't a lot of work that has to be done, to your point about rescuing somebody or whatever. It allows us from this moment on to be very creative about what we can do and the services we can provide. And your point around the boards is well taken, and I think it's really important for this new entity that it's going to be made up of BAMSI board members and Bridgewell board members, because both boards are compassionate, mission-driven people. And I think for you and I in our current positions and our positions moving forward, it makes our work easier, working with a board that understands the work that we do and understands what we're trying to accomplish. And sometimes those things can be a little rocky as you're trying to out new things and all that. And the support that the boards give is important. But I think the fact that we're able to be creative and move forward from day one puts us at a great advantage as we do this. And I also think, and what we haven't talked about, is the benefit this is to our workforce, to our staff. The fact that not just the cross-cultural training that's going to be able to go on. Both agencies do remarkable work, and the fact that we can bring both agencies together and learn from each other and have staff learn from each other and have a peer group, an extended peer group, I think is going to be very beneficial. But it also, because of us coming together, I think there's an opportunity for us when we talk about when I say purchasing power, as we look at insurance and other things that ultimately will have a benefit downward towards staff.
Yeah.
So I think that's the other aspect that we look at, is that this is a great opportunity for our staff on many different levels that I think we'll be able to see over the next couple of years.
Yeah, I totally agree with you. And, you know, I sometimes get accused of being political, but I'm not being political now, because we're facing a very difficult 2 or 3 years in terms of what comes out of Washington recently. It is, I don't think it's political to say that we have a federal government that don't necessarily believe in a lot of the things we do. You take HIV, AIDS case management, you take harm reduction, and those are things that they've actually said they're going to defund. So anything positive that allows us to generate margin that goes right back into our buildings, into the quality of care that we deliver, and to our staff salaries is really important. And I think that's another piece of this, that in order to survive in the next 3 to 5 years, because I think the landscape is changing. In fact, you know, somebody said to us the other day, a $100 million organization right now will be the equivalent of a $50 million organization in 5 years. So there is, it's not without peril to do nothing. And I think that's what we're looking at, right? That how do you position yourself, the staff who, you know, are the engine room of what we do, and the people that we serve, how do we position them so that we'll still be here and we'll still be thriving and opening new programs in 5 and 10, 15 years?
And I think that's an excellent point. And I think that sparked our initial conversation, Peter, between you and I last April.
Yep.
Is again, we talked about best outcomes for our individuals, but also best outcomes for our staff, and how do we get ourselves there? And yes, you know, I don't believe it is political to say that the federal government has kind of shown its hand on where they're looking to spend their money and not spend their money. And I think all of us are concerned about the Medicaid cuts that are coming in the end of this calendar year, take effect January. You mentioned, you know, funding cuts that were put in place not, you know, a month ago for a day for HIV prevention and harm reduction, thankfully reestablished the following day. But again, I think it was the tip of the hand of where they're looking to go. For Bridgewell, we see it on the housing side, where they're looking to get rid of temporary housing. And so I think it's important for us. And one of the things that I think helps us as we come together is it does give us a greater opportunity for advocacy on the state and federal level, because we represent 50,000 plus individuals, 37 to 3,800 staff members. Our services will cover roughly 2/3 of the Commonwealth of Massachusetts. It puts us in a unique position to be able to hopefully have a, lack of a better term, louder voice, but a bigger seat at the table to kind of help influence direction on where money should be sent, and what happens when that money is not spent, and what is going to be the ultimate outcome. Because I think especially on the federal side, it's short-sighted at times, where they look at cost savings, but don't look at the long-term impact of a short-term cost saving. So I think that's the other aspect that that's going to be beneficial for us.
Yeah, and sadly, you don't know what the consequences of that are until that time
happens.
Passed, or after. Yeah, I think that's right. And I think, you know, in the last minute or two, let's talk about timelines, because people probably want to know when this is going to happen. One of the things that kills a deal, as they say, is length of time. So we're moving quickly, right?
We are. So our goal is, well, it's not our goal, it's going to happen. So this new entity will go live July 1st. So the merger of Bridgewell and BAMSI will be July 1st. It will take effect. We are in the process of developing a new name. So this new company will have a new name, a new brand, a new logo. I think for both of us, it was very important as we go live July 1st to have that kind of rebranding. And I think your point is well taken. Dragging it out just doesn't benefit anybody, doesn't benefit our individuals, families, staff, or whatever. But also, not to kind of overlook the amount of work that's been done over the last 8 months for us to be able to go live July 1st. There's been a lot of people who have worked behind the scenes and a lot of work that's been done to make sure that we're in the best position possible so we can be live July 1st. So it's an exciting time. I mean, there's a lot of work to be done, but I think this is an exciting time for us, and I believe it will be an exciting time for our individual staff and everybody that's connected to us.
Yeah, and a big shout out to all of the work that everybody's put into this. It has been a major lift, but hard work makes this possible, and that's the direction we're moving in. Chris, we're running out of time as usual, so thank you so much for coming on, and maybe we'll come back together in a couple of months and let everybody know where we are as we come together and do our integration plans and move to the 1st of July.
Absolutely. Thank you very much for having me, Peter.
Thanks, Chris. Take care. Bye, everybody.